So I'll just quickly start, and I maybe the people who were in my session could keep me right here because there was a lot that was discussed. We were in the art and healthcare breakout session. So we started the session thinking about the opportunities to utilise art and culture to prevent ill health, potentially from an early age. So we were thinking about how we support caregiving, child development, and the development of self-management tools. And we had a really lovely conversation around what we ended up calling the primary school model, and how I think we all probably had a similar experience at primary school where art is across kind of everything, and we use art to like explain maths or geography, and the fact that there's a shift in secondary school. So we had quite a good conversation about how we could, well, what are the components and how we can kind of bring that over into the community and healthcare settings. It led to a really interesting discussion on the communication, how we talk about art as well. The fact that young people in primary school and really from very, very small, from early childhood, actually have self-management tools to regulate mental health and emotional upset, and when they're feeling anxious or positive distraction. We just don't necessarily call it creative well-being. We don't have that kind of awareness at that age that is what we're doing. So we talked a lot about that, and how do we actually kind of share that that's what it is? How do we let parents know that's what it is, so that we can embolden our young people from a really early age, and in the hope that would maybe carry on through secondary education. We talked a bit about how education is kind of streams are, and then therefore a lot of people kind of opt out of it. We talked about the image as well. We talked about stigma. We talked about TikTok as well. I've written down TikTok. We also touched on with our second, we talked about giving people agency and dignity, and that led us on to our second provocation, which bear with me a second. Was given the remarkable evidence around art's healing impact, how could we support people with existing chronic and terminal conditions to access creative opportunities? We talked a bit about end-of-life care as well. And we talked about the role of the therapist. We were lucky enough to have a music therapist in our room who talked about her work with end-of-life care patients and the role of music in that. So we talked quite a lot about how we can use different art forms as well. I think Naomi was mentioning as well, of visual art, using kind of asking people experiencing difficulties to express their feelings using visual art as well. So there was a lot of opportunities, we felt, and just how do we kind of pull all of that together by working with our health partners to kind of try to initiate more actions around about that. We talked about AI. I think all conversations end in a conversation about AI these days. We talked about, bear with me a second, we talked about some research, Val, you shared De Montfort as well, which was really, really interesting, which I think if we could share that in the event report, that would be fantastic. And I'll end on exploring by doing, by actually doing. How do we get the message out that it is about the process, not necessarily, and how do we hold safe spaces, I think we talked about as well, it being really important. Making it cool, I think we talked about as well. That's a challenge, and how we talked about how art equalises people, and that's such a really important thing when we think about health as well, making people feel equal. I think that I've definitely missed bits, but hopefully that sums up quite a lot of it. And I'd like to invite, I think we have Susie from the youth group to feedback. This has collapsed a bit, sorry, I'm just going to try and prop it up a little bit.
So we started off talking about on how we can work with kind of young people, so kind of children through to adolescence, and how we approach and how we contact those people to involve them in kind of art and creativity. The system is broken, came up quite a few times, especially when talking about schools and the focus in schools on finding the thing that you're good at and having to be really good at it, rather than just finding something that actually makes you happy and that you enjoy doing. And through the school process, the focus changes from doing something that makes you happy to doing something that will tick a box or that will allow you to earn money. And kind of lots of kind of conversations came off that. So the opportunities were to create space for creativity, to create space to investigate your imagination and to just allow yourself to explore things. That art and drama could encourage empathy, could encourage people seeing things from different perspectives. So that in drama you could play a role of somebody that you've never imagined what that life could be like until you actually have to be that person. And so it gives you many more opportunities to explore different things and different things that you wouldn't come across. The barriers can often be, if you take that into schools, whatever happens in schools, some people just will not engage with because of the experience they've had within school. So if school says to go and try something, you won't. So maybe there's other spaces that arts and community groups could be involved in outside of the school. But in this area, especially because of the ruralness, school's the one place that everyone can more or less get to. So so it is an opportunity to reach those people that can't access other groups. The barriers we looked at, just the structure in schools can create its own barrier. To be creative, there's a level of trust needed to be vulnerable, to explore and to create, and it's building that trust with communities and with youth and with groups that needs to kind of come first. One of the key things went back to one of the talks earlier, was to treat art as a behaviour rather than a skill, and that kind of goes against everything that is currently in the education system. It's all about skills development and controlling behaviour rather than exploring behaviour. So we need to change and adapt the system, work with community organisations to partner the delivery within schools so that you can give them a taster and then they can access that activity out with the school system. The barriers, it's no point doing art because I can't draw, or I can't sing, or I can't act, or I can't read music, therefore music's not for me. Or you're not allowed to do it because you don't have a basic skill level. So it's about how good you are rather than how fun it can be just exploring. So ideas we looked at, so trying to reach out in other spaces, not just within schools. Workshops in local areas, so taking the activity to the youth, where the spaces where the youth hang out or adopt as that's their safe space. So can we bring the art to the safe space rather than get them to come to us? And then how do schools and arts community groups connect, because they don't speak the same language, because they don't have the same outcome targets. Because it's for the arts and the community groups, it is about the enjoyment and the participation, whereas the schools, through no fault of their own, it's about achievement and pass rates and kind of ticking those boxes at the end. So maybe if some of the targets for schools were more holistic rather than numerical, then maybe that would focus their time to do more of it. So too many restrictions in the current system, and it's constantly having to work around those restrictions. So yeah, it was a lot about broken systems and having to work around barriers rather than kind of ways of getting through the barriers, or actually trying to get the barriers kind of removed in the first place.
Fantastic. Thank you very much. That was really good. Yay! Go Team Youth. And lastly, the community team, the community group. Okay, so my notes are not great, but anyway, I also don't like how much I can hear my own voice.
So we kind of started the conversation talking about like kind of creativity is for everyone, isn't it? That's the provocation. So it was kind of like thinking like who is everyone and how do we define that, and also kind of like what are the barriers we're facing in like reaching everyone. So I think the main thing we ended up talking about was that when it comes to discussions of like creativity, a lot of people were saying they struggle to reach men, and I think that's just to do with I don't know. It's just like a gender thing, isn't it? It's not. Men are kind of. I don't know. My brain's.
It can be quite isolated,
yeah,
quite difficult to reach.
It's just difficult to reach men when it comes to like creativity, and then we started talking about like men's sheds and what they're doing, and why that became such a phenomenon. And it's kind of like, well, they are doing creative things in men's shed, but it's not spoken about in that way.
The messaging is different.
The messaging is totally different, and it's like, what it's really, I guess, like the messaging is more about like getting together with other people, like getting together with other men, like socializing, and then we had people in our group who run Get Together Dumfries, and they were talking about what they do, and it's a women's group, but and a lot of what they're doing is creative activities, but it's literally in the title is Get Together. It's about like just meeting other people. It's about the social interactions and stuff, because the terminology that we would use is very like very different. Like the reasons we might say that we're doing these things, like creating these opportunities for people, is very different to like maybe the reasons that other people might be seeking them or interested in them. So it's just, we were talking about basically changing the language of like how we are kind of like advocating or promoting what we do to reach like more communities essentially. I'm just checking my notes. I think that's, yeah, like basically that's what we had on that, but then we also kind of started to talk about like creating more entry points, like more options for entry points for people to access creativity, because you know, like what a good entry point for one person is not going to be a good entry point for another, and there's no point in getting caught up in the, oh, is this the right way to be, you know, making this accessible for people, but you're not going to make it accessible for every single person in one way. So it's just working to create more options for people so that they just have the option.
Creating opportunities.
Yeah, they just have the option to access arts if they want to. And another point that we made, which is like a barrier that I think we face when we're thinking about like creativity being for everyone, is that when we're applying for funding, it's all very like specific. It's funding for very specific target groups. And then when you're applying for that, you're having to use certain language when you're obviously like advertising this. So it kind of almost takes away that whole like, oh, this is for everyone, because actually it's like, well, this is actually for 18 to 25-year-olds, you know, and then, you know, it all just gets very like narrowed down, and then the pool just gets smaller and smaller of who you actually are able to reach. So but it's tricky, because obviously the reason these kind of funding things exist is because we're trying to reach marginalised communities, but it does start to box people up a bit. Equity.
Thank you very much. That's brilliant.
Thank you.
So we have 20 minutes left for 20 minutes left for just questions. And we have some of our speakers here today who are ready and willing to answer any question you might level at them. We have a remote microphone. So does anybody... Sorry, Charlotte. You only have a few minutes. Apologies. Childcare is important. Perhaps Charlotte first. Yes. Does anyone have a question for Paragon specifically about the work that was shared earlier?
Definitely not offended if
Charlotte has a child too. Yes, yes. Okay. Does anyone have just a little look around? So we can let you go, Charlotte, if you want to.
If there's anything that does come up, like I'm all for keeping the conversation.
Yes, and we'll be sharing contact details and web information with our event report as well, so that people can get in touch
Yes,
with you.
please do. Love to hear from one.
Fantastic.
Always open to collaboration.
Thank
Thanks
you.
everyone for some amazing conversation.
Thank you, Charlotte.
Yeah.
Brilliant. Apologies, Charlotte. I completely forgotten that you had to leave early. So we can open out the floor to any question at this stage, or comment as well, or just experience, just to share experience. It doesn't have to be a question. And indeed, some of our speakers might have questions on what was just shared, or comments on what was just shared. Don't be shy.
Alison, is it? Alison. I'm a community. What's my job? Anybody? Lead for community health and wellbeing. I keep forgetting. I keep changing the name of teams. I'm really sorry. Right, I've hogged time. Sorry.
First name's lovely.
Oh, Naomi. Hi. I really like the way that you talked about protecting the people that work in this case, art for wellbeing and creative wellbeing. But generally, my question is about those people that work in any organisation facing wellbeing, and how do we protect those people that work in that environment, that are perhaps supporting other people that have faced trauma.
Trauma. Hello?
Doesn't have to be just trauma.
Right.
I
I really do, and I really hear, and I suppose that's something that I hope came across that I'm quite passionate about. There's a phrase that's been used a lot within today about, and even within the breakout groups, it's like, oh my goodness, I've found my tribe, but they're artists, they're not counsellors. And it's simply that people don't get us. So there's a phrase within counselling that we use: everybody wants counselling, but nobody wants counsellors. So because we're not medical model, because we're not all these things, we're airy-fairy, we're witches, I don't know anything. We're witches, yes. So I would say that there is something about maybe going through some sort of counselling skills training, or, and this is where my profession will get me, find a counsellor that isn't. Find a counsellor that is willing to work with non-counsellors in a supervisory role. Sometimes the profession doesn't help itself. We are not widely employed within Dumfries and Galloway within Scotland. It's a simple case of find someone who will see each individual listener as a person that may hear something that triggers things within them. So the answers could be that you provide counselling for your staff, or someone who's there in the background. Or it might be that you encourage creative work from your staff that allow them that space. So it might be that you form a referral stream for OPA, but not necessarily for the people who use your facility or your group members, but actually for your staff. Because it's simply the act of creativity reduces everything within us, reduces the jags, and it allows us to look at things. And then after that, what you might have to decide is, right, okay, as an organisation, if something comes up that is activating the past for one of our staff members, how do we keep them safe? Because whether we like it or not, we have a duty of care to the people who work and volunteer with us. And that's really what OPA do well. So it is finding out what has happened, that individual person and what is the best for them by listening to them, but also not re-traumatizing people within the workplace. It's a simple case of, is there someone on the outside that can come in, or do we provide funding for them to find their own counselling? It's not diagnosing, it's not labelling, it's simply saying something happened in that person's life that they've done the best they could to cope with. But right now, where they are, it's all coming back up for them again. Has that answered anything?
Thank you very much.
Okay.
I think I can speak for everybody. Not many of us are lip readers, but you nailed that one.
Can I add a comment to that? Or I wondered if maybe bring the panel in as well. I think, Chris, did you want to say something?
So, Nicola Naismith wrote a report. I was her supervisor, but she wasn't examined on it, on effective support for creative practitioners, of which counselling, she virtually came up with a menu that includes journaling and peer support networks and a whole bunch of stuff. But it strikes me that in the end, you need the counselling, but you need so there's maybe something about looking at for an organisation with a role of engagement with a bunch of organisations and some sort of overview to go, actually in this region we need a counsellor who then helps us to implement a portfolio of things at the back of which there's a counsellor. Because, do you see what I mean? Somehow there's something about operationalizing. There's something about operationalizing something which is to call it defense in depth, as it were. Because actually, then you've got the NHS and the mental health services behind the. You know, you need to be able to go as far as you need to go with the support. And for some people, that might be peer support or journaling or something else. For somebody else, it's I'll shut up.
Does anyone else have a comment on that? I have something to say about it if there's no other questions. I just want, sorry, it's quite blinding. Yes.
My daughter fell at school and hit her head.
Oh no, is she okay? Is she okay? I explained there was an emergency phone call. Don't worry. We were just talking about counselling within the project and the role of the counsellor. And I was just going to note that actually, interestingly, funders didn't interrogate that. I think once explained the reasoning behind it and the importance of counselling built in within a kind of art for well-being, particularly focused on mental health, supporting positive mental health, and it then supporting the team. And actually what Alison did in kind of helping to design the systems of referral and the systems of evaluation, having that counselling kind of knowledge at the actual building of a project, not just the working with the people, was really important. It felt organic though, but I think we realised once we were doing it, is this I'm sure there are other organisations with a similar model, but perhaps it's something that should be spoken about more. And the fact that our funders didn't question that, they saw that this was a worthwhile investment. And just as someone working in the project as well, working for Outpost Arts, it has been, just as a testament, it has been really useful. I don't want to speak for my colleagues, but I think they would probably say something similar. It has been, just as a person, I think we can't forget that we're all people and we all deserve well-being, at the end of the day. And often people working in creative projects don't have time to be creative. That's the irony within all of this.
So I didn't hear the question, so please forgive me if I'm slightly off, but I know that, again, when we're talking about agendas, there's a huge conversation going on just now about the well-being of the mental health and well-being of artists working in this practice for lots of different reasons. One of the main ones is that artists are coming into spaces where they're working with and dealing with situations that is not just about cultural practice. And so both Scottish Government, Creative Scotland, health organisations, but also on a national level, there is a conversation just now about the well-being of the creative health workforce. And there is a huge conversation needing to be had about being able to build in whatever that is. I'm not going to specifically comment on counselling, but just actually what provision is there, especially as predominantly a lot of the workforce could be individual artists working on their own, without the support of an organisation, without HR, without anybody looking after them. There is a real need for this conversation to be taken very seriously about the well-being and support needed within the workforce.
Thank you. I think that's super important when we think about working conditions. We often talk about the conditions that we need for other people to be well, but we need to think about the working conditions for artists and the creative sector as well, because if we're well, we keep other people well as well. That kind of trickles down. And it's particularly, you mentioned freelancers, which I think is really important. I think one of the challenges within the creative health and wellbeing space is to safeguard people. An artist working alone puts themselves in I was going to say danger, that makes it sound dramatic, but it's difficult to safeguard somebody when you're on your own. So there is a vulnerability that creatives and artists working in this field feel, and there's a certain amount of capacity that you kind of need. So that can be quite challenging, as you say, if you're not working within an organisation that has that. And obviously, it's hard for the organisation to find the funding to pay for everything that's needed as well. But we can't skimp on those things, or we're not doing it properly. Does anybody else have any other questions or comments on that?
I really like what you had to say there, Nancy. That's really interesting. But and you, Alison, as well. But the idea of counselling is sort of retrospective. I think we could do more to people who work in this industry and say, yeah, there is reasons where you might need counselling, rather than looking backwards and trying to sort of fix things that have already happened. I think I would shock a lot of people, actually, that you might come and work in the creative industry and something might upset you. That's my point. Thanks.
That more than anything was that kind of, as creatives, supporting well-being and supporting health. These are coming across things that potentially trigger things that have happened to you, are potentially really difficult to listen to. I know certainly I had a conversation with somebody recently who had been hosting a painting class, and somebody had come in and talked about the fact that they were actually only there because they wanted to keep warm, because they were absolutely freezing at home, couldn't put the heating on, and that really upset the guy that was running that class. And just how do we support the people within the sectors now, within the third sector particularly, who are either creative or otherwise, and being that face that people are talking to? How do we protect them from the trauma of being in that position? And Carl, you're really loud here.
Maybe you're like an opera singer. You're like Luciano Pavarotti. You just hold it here.
Yeah, you're right. How do we? And the answer is that their experiences will always form the person that you hire. And we cannot, life is hard. So we cannot tick every box and do a health and safety checklist. But what we have to have is that space if it's required, because the extremes of society right now and the pace that society right now, if I talk about children right now, experience a lot of pressure that this woman in her 50s didn't even know existed, but also that their parents in their 30s didn't know existed, and their big sister in their 20s didn't know existed. So we cannot. And I suppose there's something about normalising, life can be upsetting sometimes, and it's all right to be upset by situations that we come across. Family events, family stories, family life is completely different, or can be completely different from our own. And it's making it all right to have that space to talk about, blimey hell, do you know what happened today? This was said to me, and I'm like, it's just absolutely shocking. So it's not trying to fix the fact that it's shocking for that person. It's actually hearing and seeing them saying, I can hear you feel that was really shocking. But life is really, really difficult.
we have time for one more quick question or comment before our performance. Anybody have any? Valerie.
Yeah, I just really wanted to take the opportunity to say just how much I've really valued being here today and hearing from the fantastic speakers that we've had and connecting with people in the audience. As we talked about, we're looking at our kind of next vision for the kind of arts and healthcare programme, and I think what's going to be really key, Lucy, isn't it, is how we connect that to the work of the cultural partnership as well, so that that can engage with a much wider audience, because actually there's just so much that goes on out in the community that feeds into this, that we need to kind of build those connections with. And it's so fantastic to see that there's going to be publications outlining the Outpost art model in journals. That's fantastic. And Chris, it was so great to see actually some of those concepts that you were saying about how do you get that common language and how do you get that shared vision. So I think there was lots of things to build into the strategy as well. And Nancy, it was fantastic to have that national perspective, and I think we're all feeling really empowered to get D&G on the map and actually shout about what's happening here. So it's just been such a fantastic day, Lucy. It really has been a joy.
Oh, thank you. Thank you very much. Yes, we're exhausted but excited, officially. I just want to say a final thank you to all of our speakers on the stage for taking part and giving so much energy and enthusiasm to the day. Thank you very much. And you guys can get a comfy seat now. Thank you. I'll pull these off. Yeah, thank you.